skirts that could brush against a fire. With wishes for a safe, happy Halloween, this safety reminder is from Longview Community Bank with convenient locations in DeWitt, Logan, and Ford counties. Your trusted partner in hometown banking.
Your friend in Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. In studio with us today, Paul Skoron, CEO of Warner Hospital and Health Services. Paul, good to see you as always. How you doing?
Good morning, Seth. Great.
Good to hear. Thanks for coming out and talking with us as always. And big news out of the hospital this week is that the new electronic medical records are ready to go live. What's going on?
Correct. We've had the Meditech electronic health record system for the last 8 to 10 years. Oldest version, and on midnight on Halloween at midnight, we will be converting. We're switching over to the newest version that Meditech provides for hospitals in the country. And it's an upgrade that we've been preparing for 18 months.
Mm-hmm.
It is a $2 million investment. It's the largest investment after that emergency room upgrade that we did.
Yeah.
And this is so important to being efficient in the future, and bringing to the public some of the features that the larger hospitals have, such as being able to schedule appointments on your phone and interact with your patient records, access, electronically rather than just calling in and waiting for results to be presented. So there has been so much effort going into this, and we've got what we're looking for is we have signs in the hospital asking the patients to be patient with us as we ask them. We may be a little bit slower as we're confirming every patient that walks in after November 1. So we're asking patients from both the business office perspective, family medicine, health information records, to make sure they have their insurance. Everybody generally, it's good if you have your insurance card and your driver's license with you, but especially now we're asking everyone to be patient, our customers to be patient, because if we haven't seen you in a while, we may want to confirm that your insurance is current. And as we're transitioning from the old system to the new system, what we've been doing for the last couple of months is family medicine and all of our databases going through and calling out the patients that might be deceased, but also looking at, for patients that we haven't seen in a while, trying to make sure that all their records are current as it transitions from an old system to a new database. But still, if we haven't seen you, or if you present yourself after November 1, we are probably going to ask you, can we see your insurance information, your demographics, to make sure that your employer, your address are all current. So it's very important to get started in the new system correctly for billing and for your access to a medical record testing information going forward.
Did you have Meditech already?
Yes.
Okay, so I thought so. So a lot of people at home, I know there's someone at home thinking, so this sounds like a $2 million software update.
That's right. That's right.
So why is it $2 million to update your software?
That's actually cheap.
That's still a lot of money. Just because it's cheap, that's still a lot of money.
You look at a hospital in Decatur, and it probably was $40 million.
Okay.
So there is a more expensive version out there, and this is the best fit. Think about buying a new car. You'd love to drive a Lamborghini, right, or an Aston Martin, but when reality strikes, you realize, here's what I can afford that will give me all the features that I need to go forward and get to work every day.
Sure.
And this is the most efficient system, and it is in the top 3 electronic health record systems in the country. But it's the one that we can afford, and we did it once again without borrowing any money. That is like a Warner Hospital hallmark. We haven't borrowed any money in 10 years. So we have funded this with our own operational cash.
Wow. To that end, why, if it's just a simple upgrade of a system you've already got, why does it take 18 months to prepare for? Why isn't it just shut things down for 4 or 5 hours one day and it, boom, you're into the new system? You know what I mean?
Sure.
I guess explain that to us a little bit.
That'd be great.
It would, and
Yeah.
it sounds like it should be that easy.
I know.
in my opinion.
I know. So what have the providers, the doctors and the nurses, been dealing with for years? It's looking at a couple of different databases to know everything about their patient, and now they'll be able to look at one database. They'll be able to turn the switch on and look at their one patient that they're treating, and all the systems will come together. All the tests will be in one database, and therefore they will be able to spend more time with the patient and less time looking up records. It takes a lot of new databases to be built from scratch to make that happen. And that's the programming that's been going on with the Meditech software engineers in conjunction with our core team, which is the managers that run the departments, informing the Meditech staff what is unique about Warner Hospital and customizing those databases for Warner Hospital.
Got it.
So then, within the last couple of months, once that database was built, we started testing. We started having a test system. For months. We've been testing the test system, and at the same time running the older system and looking at them in a parallel feature to make sure that they're both running correctly. But it's at midnight on Halloween night that we'll actually flip that switch and only work off of the new live system.
Got it. Paul Skoron, CEO of Warner Hospital and Health Services, in studio with us this morning as we talk the new electronic medical records system that will be in place again midnight, 11/1 on Friday night, Saturday morning, however you want to look at it. And with that, Paul, one thing I was curious about is we were chatting before we came on. It feels like electronic medical records have been updated and updated and updated and updated at the hospital for several years. The last many years we've been talking. Is this going to be a permanent thing so you don't have to keep dropping millions and millions and millions into this stuff?
You hear about AI, artificial intelligence, a lot. From the Meditechs and the Microsofts and Amazon and all that kind of stuff. Within health systems, artificial intelligence is impacting software, and it is forcing upgrades and an investment in software more frequently than it used to in the past. But we feel that this system is good for at least 5 years. There will be add-ons to the existing system where we won't need to recreate it like we're doing now. We did this 10 years ago. 2014 to 2015 is when we installed the existing system. So we were able to get a lot out of it. But we're behind the times, and that's why we need to fire up the state-of-the-art electronic health record system. And we feel that even with their implementation of artificial intelligence, we'll be able to stay with this system without major software investments for at least 5, hopefully 7 to 8 years.
You're telling me before we got started this morning that for folks that are coming into the hospital over the next few weeks, there's going to be some techs with this company to kind of help folks get set up, get their foot in the door with all of this, help them understand what's going on. Speak to that a little bit, if you would.
We have, in our conference room, which is called the administrative conference room, they are coming in, they're flying in. They've been in and out intermittently as we've focused on programming and so forth. But for the last couple of months, they've been coming in with the trainers, one-on-one, training our staff so that the training is the most current as we run right up to November 1. And they will be here. There will be 10 of their trainers and consultants on site starting tomorrow and for the next 2 weeks, just to make sure everything goes as smooth as it can and that all staff are as comfortable as they can. All staff don't train at the same rate, as you know.
So it's a staffing thing. It's not a patient thing.
That is correct.
Okay.
That is correct.
Got
They're
it.
not going to be helping patients.
Okay.
They are there to give confidence to the staff
I see.
that there's someone there from Meditech that will help them any last minute bugs that might arise.
I see. Okay. Okay. So for the community, how do they get this ball rolling? Do they download an app? Can they, like where and when and how and all those things do they start to see this?
So on our Facebook page, we're communicating with the public on the steps that are happening going forward. So on November 1, we won't be able to fire up all the features because we don't want to introduce any feature where the integrity of the system is not 100% first. So the first thing we're doing in November is making sure that all the systems are working properly for the basics, for being able to have a patient come in and build up a bill and then send bills out, get paid by the insurance companies. Once we see that happening correctly, then we'll fire up the patient-friendly features of access to medical records and scheduling features.
Sounds good. Very good. Well, on that note, Paul, what did I miss in this conversation?
I think you hit it all. This is pretty exciting times for us. When the public doesn't see it, but for 18 months we've been preparing for this. So really looking forward to flipping the switch and having the new system go live on Saturday.
Is this a weight off your shoulders?
Big weight.
Yeah, that you can just let this go and let it rip and
let it go, and then getting back to really promoting the strengths of the hospital.
Yeah, which we'll talk about some of those when we come back.
That's right.
Again, you mentioned the Facebook page. Is that the best way for folks to learn about all things Warner Hospital and Health Services?
It is.
Very good. Paul Skoron, CEO of Warner Hospital and Health Services, our guest in studio on the morning show. More to come with Paul on the WHW Morning Show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Thursday. Jim Taylor, RFD Radio Network. Corn starting the day slightly lower, beans higher, and wheat slightly lower. December corn opening 433.5, down half a penny. March corn down 1 1/4, 445.5. May corn 454, down a penny. November beans starting the day up a dime, 10.90 1/4. January beans up 8.5, 11.03. March beans 11.11 1/4, up 6. December wheat 529.5, down 2 3/4. March wheat down 3 3/4, 544. May wheat 553 1/4, down 4 1/4. December bean meal 313.10, up 440. And December bean oil 49.80, down 36 cents. Opening numbers Thursday morning. Jim Taylor, RFD Radio Network.
Closeout time is here for a new Chevrolet. This is Scott Baum from Baum Chevrolet Buick in Clinton and Farmer City. Yes, we have a good selection of 25 Silverados remaining in regular and crew cab models with gas or diesel engines. Some with utility beds and dual roof wheels. Also see our remaining Colorados, Trailblazers, even our full-size Suburban and Tahoes, all priced to move out. See our 25 inventory today at BaumChevyBuick.com, right from the start.
AgriTalk is the radio talk show for American agriculture. Hi, everybody. I'm Chip Flory, your host. We join you weekday mornings from 10 until 11 on WHOW, on AM and FM, and on the WHOW streams. We provide farmers and ranchers with timely insights and information aimed at improving their operations. Join me, Chip Flory, weekdays at 10:06 on Central Illinois Ag Station, WHOW.
Your friend in Central Illinois, WHOW.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio this morning is Paul Skoron, CEO of Warner Hospital and Health Services. Paul, we talked a while back about upcoming challenges for rural hospital systems with funding. And let's get an update on that. And I think folks want to maybe know is, does the government shutdown, negotiations over a budget in Washington, does any of that roll over and impact this conversation? How about some of those things?
So the government shutdown is a short-term phenomena. And unfortunately, in the last 10 years, we've had a number of government shutdowns. Because the parties, they fight about a lot of things, but exactly. And so we prepare for them, but each one is different. It's not a cookie cutter shutdown. So we never know as it starts, are we going to get funding for the billing, the Medicare claims specifically, and Medicaid that we send in. And there was some concerns about that 6 weeks ago. And there was such a hue and cry from the legislators of all 50 states that they finally said, we're going to continue to pay healthcare claims.
That went over like a lead break, huh?
That's right. And so that's fine. There was also some concern about funding for telehealth. And our Dr. Qureshi sees a lot of patients in nursing homes. Telehealth is very important because he talks to a lot of them. That finally got covered and on a short-term basis. So the government shutdown isn't a big deal. What is a big deal is what they're arguing about is what is the funding for healthcare going to look like going forward. Mm-hmm. And that's where we have a big concern. All health systems have a big concern. The largest ones are bracing for funding cuts. Mm-hmm. There's something called 340B that we access that is worth about $600,000 a year to us, and it's where funding comes for providing pharmaceuticals for people that don't have insurance. And this is something that even the state of Illinois is struggling with. They're trying to make sure that the pharmaceutical companies do what they're supposed to do and follow the law and reimburse us. Those kind of things are being argued out. So we don't know where it's going to come down to, but we do know that the old ways of getting a 3.5% or 4.5% increase in Medicare funding every year, that's not happening anymore. Mm-hmm. And we have to brace for very small increases, if any. It's not like Social Security where they say the cost of living is 2.8%, therefore we're going to increase Social Security. No, Medicare doesn't do that. They're providing less and less additional funding. So what do we need to do? Our costs, our salary costs, our supply costs, they are not going to go down. Mm-hmm. So we have to find new ways to promote our strengths and increase volume and retain the patient population in town and rather than going out of town. So we will be, now that we've got this electronic health record thing behind us, we will really be focusing on promoting the strengths of the hospital, such as the fact that our emergency room has no wait times to speak of. Mm-hmm. There are some times, like during Apple and Pork, when there was a rush, mm-hmm. and their waiting room is being used. But in general, 80% of the time, there are no wait times in this emergency room. Mm-hmm. So people that maybe live in Maroa or Hayworth that are thinking I need to go to Bloomington or Decatur emergency room, no, you need to come to Warner Hospital's emergency room and get treated right away.
So not thinking increases of rates or anything of that nature then at this point?
There's Medicare, Blue Cross, and then all the other
No, I mean like the hospital rate, like your actual rates, or are the rates dictated by insurance?
They're dictated by insurance.
Okay.
We can increase our rates on an average of 3%, 4% a year. It doesn't matter what we do with our rates. We put those on the bill and send them to the insurance company. And if they say we're not paying you anymore, we have to write it off.
I see. Okay.
So we have to deal with that.
Okay.
Insurance company by insurance company.
So not passing that along to the consumer.
Correct.
Then. Yeah.
Correct.
Got it. With that said, Paul, I remember the conversation when we had it a while back was, more the really rural places like a Southern Illinois, like a Nebraska came to mind. You mentioned your system not so much impacted by some of these things.
Our geographical location, you're absolutely right, Seth. That is one of our strengths. I've called us rural light for so many reasons. When we were recruiting physicians, now we are fully staffed with physicians. But the recruiting company said that is really actually true. You are rural light in that we are surrounded by geographic areas, metropolitan areas, Bloomington, Normal, Decatur, Springfield, Champaign, who have a lot of employers that provide good insurance for their employees. And a lot of those employees live in DeWitt County. So we have a patient population that has better insurance than, let's say, a small hospital in Southern Illinois, where the only employer is the correctional facility in town. Therefore, they have a lot of Medicare and Medicaid, and very little good insurance in the population.
Sure.
We are blessed with a diversity of employers that provide good insurance for the citizens of DeWitt County.
So are you watching closely the situation in Washington, or does the funding challenge stem beyond that?
No, I watch it every day, as Illinois Hospital Association does, and asks us and all the other hospitals. There's 205 hospitals in the state of Illinois. They represent them all. And they ask us, what are the most critical issues? They communicate it to our legislatures, who promote those issues for us in Washington.
Very good. Well, on that note, Paul, I've got about a minute left with you. Anything on that topic or another we need to touch on before we let you go?
Warner Family Medicine, from everyday issues to long-term health issues, we've got you covered. I'll talk about a lot more about this in the future, about all the features that we provide at Warner Hospital Family Medicine.
Very good. Well, Paul, with that, best way for folks to learn about all things Warner Hospital and Health Services.
Facebook is very popular.
Very good. Check that out. Paul, always good to see you, my friend. Thanks for making time for us.
Thanks, Seth.
Paul Skoron, CEO of Warner Hospital and Health Services, my guest in studio here this morning. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Of course, we stream live online all the time at DeWittDailyNews.com. Network news comes your way next on the WHOW Morning Show.